I believe that heartworm disease is the most important disease of dogs in this country. And I believe that the concern about resistance is the biggest problem that we face. We've learned a lot about heartworm resistant to macrocyclic lactones in the last 10, 15 years. First of all, we know that resistance is real. We don't know the extent of the problem. We don't know how far it extends. We don't know how much it plays a role. We know also that compliance is the biggest problem, and everyone agrees with this, that compliance is bigger than resistance and bigger in terms of causing heartworms, and that's something that we can do. We can affect that. We don't seem to do it very well, but we can affect that. The isolates of resistant heartworms have come from multiple places. They don't all come from the Mississippi Delta, which I think is a confounding part of this. They've come from the upper Midwest, from the East, and they have not necessarily come from areas that have concerns about resistance. So that has to be worked out. We know that the resistance is hereditary. We know that heavy exposure to mosquitoes probably makes it more difficult for these drugs to be effective. So this is an argument for reducing exposure. We know that there are genetic markers that will tell us which isolates are causing resistance to these macrocyclic lactones. And we know that there is resistance to every one of the 4 molecules, the macrocyclic lactone molecules that have been such great drugs for us in preventing heartworm disease.